How are we doing, Shelley?
If you want to wait maybe another minute,
Okay.
see if we get some more folks.
Washington 43 update license plate could be 580016.
Okay,
Shelley,
would you like for us to get started, Robert?
you can go ahead and try and take roll, and if we're not at quorum, we can wait another moment.
Okay. So good afternoon, everyone, and welcome to the Governor's Interagency Advisory Council on Homelessness. This meeting has been publicly noticed in compliance with Nevada's open meeting law. Vice Chair Robert Thompson will call the meeting to order.
Good afternoon. For the record, I'm Robert Thompson. It is 1:03 p.m. and I'd like to call the April 25th, 2024 meeting of the Nevada Interagency Council on Homelessness to order. Will the moderator please call roll?
Absolutely. All right. Chair Tim Robb. Senator Dina Neal.
Here.
Assemblyman Max Carter.
Present.
Deputy Director Emily Testweed. Administrator Robert Thompson.
Here.
Administrator Stephen Acroft.
Here.
Colonel Mary Devine. Lieutenant Christopher Gurrell. I'm sorry, was that Christopher Gurrell? Okay. Lieutenant Brandon Zirkle.
Here.
Sheriff Jerry Allen. Judge Mike Montero. Dr. Katrina Grigsby Thedford.
Here.
And Judge Christy Craig. Robert, I'm counting that we have 6 and we need 7 for quorum. So as of right now, we do not have quorum.
Okay, we'll wait it's only 5 after. Let's wait another couple minutes. We have canceled these before and then people signed on a few minutes late.
Sure.
Okay, Shelley, we are now at 7 after. Can you attempt to call roll again at anyone that wasn't previously on and see if we are at quorum?
Sure. I'll do roll call one more time just to make sure that everybody who was previously here is still here. So Chair Tim Robb. Senator Dina Neal.
Here.
Assemblyman Max Carter.
Here. Sorry about that.
You're okay, thank you. Deputy Director Emily Tesweed. Administrator Robert Thompson.
Here.
Administrator Stephen Acroft.
Here.
Colonel Mary Devine.
This is Colonel Mary Devine.
Thank you. My apologies on your last name.
That's okay. That's okay.
Lieutenant Christopher Gorell. Lieutenant Brendan Zirkle.
I'm here.
Sheriff Jerry Allen. Judge Mike Montero.
Yes, I'm here. Sorry, I'm a little late.
You're okay, thank you. Dr. Katrina Grigsby Thedford.
Here.
And Judge Christy Craig. Thank you, everyone. We do have quorum.
Thank you, Shelley. We will now go to item number 2 on the agenda for public comment. No action may be taken upon a matter raised until the matter has been specifically added to the agenda. Comments are limited to 3 minutes. If you are making a public comment via phone, please call 1-775-321-6111, ID number 179-655-435. We are now open for public comment. If you would please unmute yourself and state and spell your full name for the council. Do we have anyone on the phone wishing to make public comment? Okay, we will now move to item number 3, a discussion and approval of meeting minutes from March 21st, 2024, Interagency Council on Homelessness. Do I have a motion to approve?
Dr. Katrina Grigsby Thedford, motion to approve the meeting minutes from March 21st, 2024.
And a second?
Administrator Acroft, second.
Thank you. Any discussion? All those in favor? Aye.
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 Any opposed? Thank you. We will now move to item number 4 on the agenda. Presentation of CARES Campus, Dana Searcy. Item number 4 is for information only. And Ms. Searcy, we are all yours.
Thank you. Good afternoon, everyone. I am Dana Searcy from Washoe County, and thank you for the opportunity to provide an update on what is happening at the Nevada CARES Campus. As many of you are maybe very much aware, the campus was opened in the spring of 2021. The primary purpose of that first phase was to set aside enough land and to erect a sprung structure that had enough capacity to be able to socially distance everyone that needed shelter during COVID. This increased our shelter capacity for men from about 150 to over 600. And much of the time since then, especially in the 2 years that followed, was about the design of what the rest of that campus would build out to be. It was always the intent that the campus would provide services and not just be a place for shelter. We worked with a lot of our national partners and our local partners to identify what those needs were and to ensure that this campus was in alignment with best practices and successful models across the country that we have seen. So much of this program model, again, is about not just shelter, but also having services available on this site. This includes a wide variety so that we can meet each person where they're at, identify unique needs, and make sure that we can provide services to that one individual. The campus is housing focused. So again, the idea is to get you out as quickly as possible into an option that is a permanent option for housing. Another unique thing about the campus is it's what we call low barrier campus, but there are no background check requirements, no ID requirements. There's no criminal history requirements at all. That is pretty unique in this state. There are also no sobriety requirements. Pets are allowed, and we do all we can to accommodate couples and keep them close together. And really for us in the region, this is the only option for a lot of our most vulnerable. So look at our progress on the left side of the screen on the operations side. When the campus first opened, again, that initial goal was about having enough capacity. So quickly we started to focus on ensuring that we had enough staff, that staffing ratios were appropriate, that we could increase security and the safety processes in place, and we could add those services like behavioral health and medical services. On the construction side, on the right, that is just a quick checklist. We're in the middle of phase 3. We are hoping to finish phase 3 later this year and open our service buildings at the end of the summer. And then our supportive housing is on schedule to open in the spring of 25. We'll walk through what all of this looks like. This is a look at the budget. It is just over 70 million. This is for phase 2, 3, 4. The initial construction was about 18 million for that land purchase and sprung structure. This was truly funded by all types. As you can see here, Washoe County, Reno, and Sparks was that initial distribution, but there's also quite a bit of state funding and federal funding, as well as capital campaign. And this is a breakdown. I just included this in case you are interested. You can see the detail. But the punchline here is really that most of this funding is not going into emergency services, the shelter itself. It is going into the services and the housing piece of the campus. This is just an overview of that master plan, and we're going to go through each section. So Safe Camp started as an idea to allow tent camping because of the weather. We quickly moved to Mod Pods. We looked all over the country for different ideas for this Safe Camp, and the closest we could find was in Denver. They have ice fishing tents, they're called. They're like a mylar material, and they had to put heating grates in the ground during the winter, and it still wasn't warm enough to be able to keep people in tents. So these Mod Pods are 8 by 8 feet. They are heated and cooled. They do not have any plumbing. So this permanent site now looks like this and has a community space with restrooms and eating space and a training space. Phase 2 was all about updating the sprung a little bit to allow for separation. So this large sprung structure, 46,000 square feet, was separated into 6 different dorms and a property room. And those dorms are broken down into 2 different types of beds. One is the bunk beds in that lower photo. When you first come into the campus, that's where you will start. And then as you engage with case management, you can move into a private cubby, which has a bed and a locker space, and again, just allows a little more privacy. Permanent showers, restrooms, and laundry were our next focus. We built these facilities out. There's 2 large buildings attached to the sprung. There's plenty of capacity. The resource center came next. So a large garage bay that used to house RVs, like 40-foot bus style RVs, was transformed into what we call our resource center. This is a day drop-in center that has services on site. We have lots of partners here that you can meet during the day. We also provide meals here. We have computer and phone usage. You can charge your cell phone, and there are showers and laundry and restrooms in this facility as well. This also includes our emergency overflow. It was important to have a space inside the campus that could be opened at a moment's notice. So if it's too hot, too cold, too smoky, whatever is happening, we are able to add capacity that very day. So there's 84 bunk beds that are a permanent fixture now at the CARES campus. This is the building that is currently under construction, and we're hoping to open this at the beginning of August this year. This will house all of our services, our case management, our dining room, all of our intake and diversion programs are all in this. And this building will also have a lot of services. It has a nurses area, a training area, and access to computers and phones as well. These are just a couple of renderings of what the spaces will look like. Phase 4 is the supportive housing. I think this is the part that most of us are the most excited about. We were lucky enough to receive a grant from the Home Means Nevada initiative with Nevada Division of Housing. We are very grateful for that. This will build out 50 units of supportive housing at the CARES campus. There's a community space, an outdoor space, and 50 rooms that will be individual occupancy. Each has an ADA accessible restroom and kitchen. And this is a look at those different spaces and the timelines. Again, everything in green is complete. That orange on the bottom is what is under construction right now, and the red section is our housing that will be opening in spring of 25. The yellow space on here is another project that received a Home Means Nevada housing grant. Accessible Space will be building out 50 units of supportive housing, and then phase 2 will come later, which will be an additional 70 units of affordable housing. So a little look at the data side for those of you who appreciate that. We have a lot of people at the CARES campus is what these next couple slides will show you. Over the fiscal year of 22-23, we served almost 2,800 unique clients at the campus. And you can see over 2,000 bed nights. That's every head on every bed. And when we take a look at age groups, we talk about some very high needs here. So 55% of those people inside the CARES campus, and this snapshot is from December, but we see this stay pretty stable, have a documented disability. 43% are age 55 and older, and almost a full third are completely non-insured. We rely heavily on our emergency services in the region, both law enforcement at the Sheriff's Office of Washoe County and also our medical service response with REMSA and Reno Fire. We track this data pretty closely. You can see on the right, we see a nice decline with our REMSA response. We have directly attributed that to a nurse that was brought on site. So we now have a nurse we have for the past year on site 7 days a week. And our law enforcement response remains fairly steady. Partnerships are a huge part of the campus. One piece that was always part of that vision was that it would have enough space for our partners to come on site. So all of these partners have MOUs in place right now with us and are on site providing services on a varied schedule. And local trends. So our utmost important number that we look at is our sheltered and unsheltered count, or our by name list. This list was topped out at about 2,400 last year in February, and this year in February we were just under 2,000. So we've seen a significant decrease there. We watch it close. We're just starting to see that decrease, and we're hoping that that is a trend that will continue. And this is everyone. This is not just CARES. This is the entire Northern Nevada COC in Washoe County. And housing placements out of the CARES campus continue to climb. This number, we are hoping, the goal is out of the campus 50 placements into permanent housing each month. This number is currently about 35. And then we're closely watching that recidivism, and we've seen a nice drop, also contributed by more case managers on site, more behavioral health therapists on site. There are now 6 therapists on site, which has been very helpful. We try to focus on each of those placements being sustainable long term, and then when someone does come back to the campus, then we're taking an extra look at what happened and how to improve that in the future. And then I also thought I would throw this in here. There is a newsletter that the campus puts out. This is directed for clients. Really, it's a paper newsletter to show a map of the construction so they know how to get around, and a current schedule so that everybody knows where to access those services. But this includes a success story every month, and we keep these on our website. So if you're ever looking for an update, it's a good place to find out what happened. And that's it. With that, I'll turn it back to you guys, and I'm happy to answer any questions you might have.
So for the record, Robert Thompson, can we talk for a moment about the 29% uninsured? I saw that there were partners from the MCOs there, so I'm assuming those partners are there to help people sign up for Medicaid. Are they coming in 29% uninsured and staying uninsured, or is somebody helping them obtain Medicaid eligibility?
No, we are. You're right. We are working as quickly as possible to obtain Medicaid eligibility. So the MCOs do not directly sign people up for services. We rely on other partners for that. Right now we are driving people down to the Social Security office and the SNAP's office and work through setting people up through benefits. We used to have a member from the state that was on site each day of the week, and we haven't had that for some time. I understand they've had some staffing issues. The Food Bank of Northern Nevada is also on site signing people up for food SNAP, for SNAP benefits. But it is very challenging to find individuals that are qualified and certified to sign people up, and that is a long process right now for us.
So Shelly Aguilar, who's on the phone, who is our moderator, is the chief of the Division of Welfare and Supportive Services Outreach Coordinator. The Welfare Division is having significant staffing issues in Northern Nevada. That is not a secret, and our vacancy rates are dropping for the first time, but the vacancy rates are dropping faster in Southern Nevada than Northern Nevada. We are just having the competition for the government jobs in Northern Nevada constantly keep taking our staff. We have offices that should have 40 workers working there, and they only have 13. So yes, that we are struggling there. However, engaging with Shelly and at least getting on the wait list so that we can get you in the queue when we do ramp up that staffing so we can get people out there would be a benefit. So just throwing that out there. And everything we were looking at, is this all for single individuals? There's no families, there's no children?
That is correct. Yes, the CARES campus serves single adults and women. There's the Our Place campus, which is over at the NAMS facility, and that has the families and the children.
Okay, thank you. Do any other members have any questions or anything they want to throw out?
I
Uh,
have,
Go ahead.
I'll wait for the judge.
Okay,
It's
so,
okay. I definitely don't need to go first. But I think one of my questions was answered because I wanted to know about families. But also you mentioned having therapists on site. I think you said you had 6 therapists on site. What are you providing in the way of therapy services?
So right now, they're focused mostly on crisis intervention. It's a pretty intense situation we have about 800 people on site on any given day. The goal was to have the counselors on site to establish a program that would allow kind of a triage system, a crisis system, and then also getting people to a stable place that then they can match people up with services. A lot of our group is on waiting lists for those services. And so we're doing what we can on site. They've just started some group therapy, and we're seeing a lot of success in that. A lot of what we find is that people are fearful of that or don't want to leave the campus and go to a new place right away. And so if they can start the process on site, and then we can do that warm handoff with a different agency offsite, that has been working better. It's very much a pilot for us. We were not intending to have any counselors on site, but because of the need, we decided to go ahead and fund those positions, and it's been really beneficial for us.
Very good. It's great to hear. I was impressed with that. Thank you.
Senator Neal?
Hi. So I was looking at your budget. How much of the MCO pre-tax dollars goes into that budget, or do you get any of that? Do you remember the bill? It was SB 309. It has the reinvestment committee, and then it allows for a portion of the dollars. Well, MCOs, from my understanding, decide how they will use it, but they have been saying that they use it towards some homelessness services, some supportive housing, etc. I didn't see that in your breakdown.
We do not receive any funds for them. We have recently this year applied for a grant for one case manager through Silver Summit, and that was granted. And the purpose of that grant is not to support the CARES campus. We are trying to show how similar to the supportive housing model, but if we can have a case manager follow someone into housing that maybe wouldn't qualify for permanent supportive housing, that we could see success equal to those types of programs by just having additional case managers that can help. So we're doing that pilot with Silver Summit, and other than that, we do not receive any direct funding from the MCOs.
Okay, I have a follow-up. Do you participate in the reinvestment meetings?
We are involved across the county, but I don't think that we are directly involved in the meetings that you are referring to. We've met with them outside of that and put in some direct requests, but we have never been provided direct funding.
Okay, good to know. Second question, the recent provider tax that it's now accruing money. Are you guys planning on asking for any of those dollars to be a part of your model in the future?
I am not familiar enough with that tax, but I will look into it. I think that's a good suggestion. I would say the county honestly tried to do the right thing as this campus was getting off the ground and everybody was scrambling, trying to move quickly. The county funded it 100% with general fund dollars just so that we could get it stable and provide enough staffing right off the bat so that it was safe and controlled space and had services that were needed. And now we're just, since construction is wrapping up, we're just starting to have those conversations. We've signed up for Medicaid reimbursement so that we can work on how to pay for those counselors and case managers that are on site. So that was the initial funding lift. And now it is the next focus that we have just started talking about, is how to fund this long term. So I appreciate both of those suggestions, and we'll go back and look at it.
Yeah, if you look at the last IFC meeting, I think it was a couple weeks back, it was a 9-hour meeting, but somewhere in there in the backup, you can find this conversation on that provider tax.
Okay.
So at least you form the question. And then my final question is, how are you managing what's your medication management process within the facility? And I'm asking this question because I toured the Las Vegas Cares campus, and they say, folks they see the doctor, they get on medication to stabilize them. Some do, I guess they're starting to do some long-term medication so that if they leave 30 days later, like, it's still in their system. But what I noticed was that there were folks who were sitting inside of the courtyard who were literally having an episode, and I didn't understand how the medication process and management was happening once you're inside, and how we ID someone that may be going through an episode while they're in care.
Yes, so that is a lot of collaboration and coordination. I think our access to a prescriber for psych meds is pretty limited. We rely on our partners, very specifically the sheriff's office in the jail, or the teams at the NAMS campus. A lot of these individuals we all know and we all have served for a very long time. And so we can share information about specific diagnoses and the medication that has been prescribed in in previous interactions. Then we can try to get someone to just pick up those medications and provide them. Our nurse on site does a lot of that coordination, as well as our lead behavioral health counselor, again, working with the jail and Lakes Crossing and the facility at NAMS campus to try to bring all that information together. We do have a place on site that people can keep their medications, and they can come and take their medications. We will keep it locked up. We do not provide medication management as far as going and reaching out to the individual and encouraging them to take that medication. Not yet at this point, but it is definitely something that we've talked about, because we're all seeing that is another crucial need. We have a couple of different pharmacies that will deliver on site. We have community mail on site. Over 1,000 people receive mail out of a building that is there at the facility. And we have 2 prescribers in particular that will deliver medications there, so people can receive those medications on site.
Thank you.
Anything else? Mary?
Yes, this is Director Devine. I have a question in relationship to the average number of veterans. Do you keep track of anything like that? And what veterans organizations are you partnering with?
Yes, mostly we work very closely with the VA. Anyone who identifies as a veteran, we are getting them in touch with the VA, trying to confirm that they are a veteran. If they are, then we do have a case manager that is specialized in veteran services and facilities, and she's working very closely with them to get them out and on to the other programs. We have a lot of HUD-VASH in the area that is unused. So anybody that can qualify for that housing, we're working as quickly as we can. We have seen about 60 to 70 veterans inside the campus at any one time, and that is self-disclosed veterans. So once we verify status, we're usually talking more like 30 or 40, but we do everything we can.
Thank you. I appreciate that.
Do we have any further conversation for item number 4? Okay, we will now move on to item number 5, presentation on Nevada Homeless Alliance, Dr. Thedford.
Hello. All righty, you guys can hear me okay, right? All right, awesome. So my name is Dr. Katrina Grigsby Thetford. I'm the current executive director of Nevada Homeless Alliance. And we'll just stay on that slide for 1 second. So Nevada Homeless Alliance has been in Southern Nevada since 1992. We bring people together to advance solutions to homelessness. And we do this by partnering closely with federal, state, local government, our philanthropic partners, faith-based organizations, and people who are currently or who have experienced homelessness in the past. Our mission is to advance collaborative strategies and to end homelessness in Southern Nevada through advocacy, public awareness, education, and coordination of services. Though we are Nevada Homeless Alliance, my personal goal is to ensure that we are looking at the full spectrum of homelessness, including those who are at imminent risk of homelessness due to evictions or that inflow into homelessness from institutions such as medical institutions, ERs, behavioral health, may that be mental health institutions, detox or treatment, and corrections, which will include, in broad terms, jails or prison. And so that's just a little bit about us. Really quickly, we work under 4 pillars: policy and advocacy. We do education and training, which you'll learn about as we move forward in this presentation. One of our pillars, main pillar, is the collaboration, because without collaborating with our partners on the federal, state, local, county level, we would not be able to have the success and do the work we do. And we also now offer some direct services. Next slide. So this is the same presentation I did locally. So it was just a thank you to our community providers, volunteers, donors, and all those other partners that make our events and service coordination successful. Next slide. So since the beginning, 1992, Nevada Homeless Alliance has hosted homeless stand-downs, which is now termed Project Homeless Connect, in our community for over 30 years. For years, this was a once per year event. In 2018 or 19, the previous leadership shifted to monthly pop-up Project Homeless Connects, where these were events similar to the big event, but they were smaller in nature. And so these events are events that bring all the community partners together, where there's legal services, employment services, housing services, medical on-the-spot services, all the way down to childcare, youth services, senior services, all in one spot. We found that bringing the services to the community partners on a regular basis is the most effective. So though we still have our big events where we may serve over 1,000 individuals, we do currently have 5 to 7 events per month in multiple locations all over the community. Just 2 days ago, we were at our Bonneville Transit Center under the RTC, where we served over 300 individuals with on-the-spot services, not just serving food and giving out clothes, but these are actually services where they're getting housing assessments, getting wound care, talking to MCOs, all those good things that an individual may need to resolve their homeless crisis. So just a few things about 2023. We served 4,472 clients. We had 16 of those pop-up events. And like I just mentioned, in 2024, we're having 5 to 7 per month. So next year, 2024 will show way more pop-up events. COVID pods, we'll talk about those. We had 24 of those. And we do mini pop-ups where I may just send a staff member to multiple agencies in the community to set up shop with their computer, their wireless printer, and to provide services to individuals just to fill those gaps that agency may not be able to assist with, which could include ordering an ID, a birth certificate, helping with gas. We get a lot of carburetors stolen in Southern Nevada, so we're helping with a lot of car repairs, many different things, beds, things like that. We work with our outreach teams to do level 1 encampment resource fairs. Those are encampments that have over 40 people. So we work with our partner, Help Us Southern Nevada, and go out and provide services. And last year we had one of our annual Project Homeless Connect events. Next slide, please. So our homeless diversion and barrier busing program, and I'm sorry if you can't see the white text on here. This is a program funded by Clark County with ARPA funds, American Rescue Plan Act funds. So this was a very, it's a thing we really need in our community. So this was the homeless diversion and barrier busing. We focus a lot on IDs and birth certificates because we found that individuals will go and get a service. That service provider say you need an ID. The individuals are homeless, no money, no address, no access to internet. And so we go in and we order those birth certificates, get them delivered directly to our agency, meet the client where they are, tunnel, homeless encampment, wherever, deliver that document, and then give them a voucher to go to the DMV to get that ID, which then comes to our address as well. We allow the homeless individuals that we assist to use our address for that important stuff like Social Security cards, their medical cards and things like that, right? So under this program, we 100% of the individuals we serve were under 50% area medium income, but 89% were under 30% area medium income. And so we helped 1,343 individuals under this grant last year. 1,002 of those were in the community. As I mentioned earlier, we would go to just multiple locations. And if you're from Southern Nevada, we will go to places like Care Complex, Salvation Army, Parole and Probation, our Foundation for Recovery, courtyards, and places like that, just to set up shop and provide those services to those individuals right there on the spot. Next slide. So as I mentioned earlier, we did 16 pop-ups in 2023. At these pop-ups, it was approximately a little over 2,000 individuals. We did a lot of housing assessments, a lot of those benefits that individuals need. DWSS is always at the table, tabling, providing services on the spot. Social Security office is there. We have multiple MCOs at every event. We have our nonprofit legal aid partners, as well as our DA. That often come out, and some family court people. We have agencies that do immigration services. Of course, we have the clean syringes and all of those things that individuals need, because we see an increase in fentanyl and opioid use. So all that harm reduction. We have our mental health and substance use providers right there on the spot. We're forever getting people transported to detox or sober living or whatever they may need at that moment, because it's really important to have everything in one place. So if the person comes to a booth and they need legal aid or mental health, it's not like, here's a bus pass, go here, go across town and spend hours on the bus. It's like, okay, we're going to walk you to this table to get that service. So we also work with our local shower truck. We provide meals in areas that doesn't have a lot of feeding, because we believe that our community has enough locations where individuals can go eat. And we often set up a clothing store for individuals to get clothing if they are in need. Next slide. So this is our fall Project Homeless Connect, our big event that we host every year. We had about 788 clients that attended that event in one day. Medical, dental, and vision is always the biggest service at our Project Homeless Connect. And over 1,000 people got same day services. They had the curtains, and we're doing medical checkups, vision screenings. It was really cool that with the dental checkups, the office that came, they closed their office 2 weeks later to do follow-ups with everyone who came and got a service. The people who were experiencing homelessness or those who were at risk of homelessness were able to go in and do those follow-up appointments. Behavioral health, of course, that's at every event. And those are just our numbers for that one-day event that we're mentioning that happened in the fall of 2023. Next slide. These are just some more stats of what happened at that fall 2023 Project Homeless Connect. So of course, right, showers, haircuts and things like that. But one thing that we are really excited about was a new development this year, was the implementation of a coordinated entry and housing problem solving strategies. And so with the housing problem solving, we're just not screening individuals and doing a housing assessment. We're actually having a person-centered, trauma-informed conversation with the individuals. So though 195 participated in coordinated entry housing assessments, 115 checked in. That means they had a previous housing assessment and they have to check in every 30 days. 80 of those were referred to housing problem solving, where 8 were placed at our navigation center, 10 were at a place at our betterment program. There were 12 tickets to home, meaning individuals we were able to talk to that host home on the other side to ensure they can live there, and bought them a Greyhound ticket or a plane ticket. I think there were 2 plane tickets to go back to where they live at, because we're transit in Vegas and some people come here and get stuck. Their families don't even know they're struggling. So we do those conversations with the client there on speakerphone to talk to that host home. So 10 individuals got housing problem solving funds. That means they were in a hotel or motel and they lost their job and they start back next week, pay for a month here or there. Individuals who are at risk of homelessness, we were able to go and get those arrears paid on the same day. And some individuals who had approval for housing, such as vouchers, and they didn't qualify for a deposit because they've gotten one in the community before, we were able to go in and pay those deposits to get those individuals housed that same day. And about 24 people were sheltered, were transported to shelters. Next slide. So, few years ago, under previous leadership, Nevada Homeless Alliance started hosting yearly Family Connect events that were similar to our Project Homeless Connect events. So these Family Connect events were held in May, right after school ended, and they were specifically for families, homeless youth. In 2023, we started monthly Family Connect, pop-up Family Connects, and now this year we're doing monthly pop-up connects, Family Connects throughout the year in partnership with Title I Hope and Clark County School District, where we are trying to target those Title I Hope families to ensure they have access to all the services that they need to resolve their housing crisis. And we also work with our youth homelessness partners at these events that are held the last Saturday of every month at a school to provide services to any of our unaccompanied homeless youth. Next slide. So last year we had our second annual conference on ending homelessness right there in Reno. So that was amazing. We started our inaugural Nevada statewide conference on ending homelessness in 2023. This was the brainchild of the previous leadership, and she transitioned to a new agency. And 9 months into my job at Nevada Homeless Alliance, we successfully hosted our first annual conference in 2022 in Southern Nevada. So our goal is even years, Southern Nevada, odd years, Northern Nevada. And so each conference was sold out. In 2022, it was at UNLV, sold out conference. We only had 300 seats, but that was a big venue. 2023, we were at UNR. And so our conferences, I noticed that a lot of our individuals in our community, we go to DC and Texas and New York for conferences, and that's great, but we don't have anything to call our own. And so I think it's important just to have that conference that we call our statewide conference, where we're able to invite individuals who are doing the work in the community. We're able to identify gaps. We're able to invite speakers from other areas, from the federal, local, state, whatever, to come out and share with us what other communities are doing. And we also get to learn from each other, meet new people, and network. So our 2024 conference will be in Southern Nevada this year. Next slide. Oh, this is about the conference. So I just pretty much said a lot of this about our conference. And so you guys will be receiving an invite here soon. We're planning the conference as we speak. So I want to say that our conference featured presentations from our HUD technical assistants and the Nevada Interagency Council on Homelessness, presented on the housing strategic plan, which was pretty amazing. And we also had some presentations by our Lived X consultants. Next slide. So our Homeless Service Provider Training Institute, it plays a real pivotal role in addressing the critical need within our network of homeless service providers by delivering comprehensive training on evidence-based practices and professional skills for our frontline workers. And this is not just for homeless services. So we have a lot of nurses, we have library district staff that comes to these meetings, we have students, we have our police officers that come to these trainings, because there's a wide array of topics that we talk about that just helps that provider or whoever is engaging with individuals experiencing a housing crisis. That kind of helps. So we go all the way from trauma-informed care to motivational interviewing, diversity, equity, all the way down to the de-escalation, self-care, current trends in drug abuse, and many, many more. So in this training from last year, we were able to serve, I think there's some numbers on the next slide, or is there not? There's not. So in 2023, you can go back to that slide, I'm sorry. We were able to provide training to 489 individuals from 26 agencies. And then we also have similar trainings on our training platform online and about 100 individuals throughout the state. So we see a lot of rural and Washoe County agencies registering and buying the training bundles online. And so about 150 individuals throughout the state have completed one or more of our online trainings under the Homeless Service Provider Institute. So I think that's really important. And one of our great highlights that we're really proud that Clark County saw a need for training and were able and willing to partner with Nevada Homeless Alliance to ensure that our community, our providers were trained on these best practices to have better outcomes with individuals we serve. Next slide. Last but not least, as many of you know, I hold the lived experience seat on this board. Though my lived experience was about 15 years ago, it was a 9-year experience of literal homelessness in Southern Nevada. And 3 of those 9 years were in Northern Nevada, as well as many other things. So I'm really passionate about making sure that individuals with lived experience are included in the work. Who knows how to solve a problem more than the person who has experienced that thing? So we think it's really important to have lived experience, people with lived experience of homelessness involved in making recommendations and reviewing documents and providing feedback to organizations in our community. So currently we're funded by Southern Nevada for our Lived X consultants, which is a diverse group of individuals with lived experience of homelessness or housing instability in their lifetime. That presentation is not coming up. At my last presentation, they did their own presentation. I'm just going to give you a summary of the work that they've done in our community. So they have a protocol where individuals can request their assistance. And so they received 22 requests in 2023, 55% were local, 18% were state, and 27% were national. So we 100%, they work closely with Clark County and our HUD technical assistance providers and Nevada Homeless Alliance in our local stuff. But we also have the opportunity for other entities who want the expertise of people with lived experience to learn from or to build their program or just to implement some new practices. We want that to be available to them. So they, for instance, they help the National Care Advisors. They did consultation, education, and to medical staff to help them improve their services for those facing homelessness or evictions in-house hospital services. They also gave some feedback about burnout and caseload ratios to the National Care Advisors, to these doctors and nurses that reached out to us and wanted to meet with them for consultation. They participated in multiple other things, such as a coordinated entry secret shopper event that happened in our community and is now posted on the HUD Exchange website. We had a member attend Capitol Hill Day at the National Alliance to End Homelessness Conference last year in DC. This year, they're working on things such as climate research. They're still working with our COC on governance and kind of restructuring coordinated entry. They're doing Capitol Hill Day and the conference again this year, and many, many more things. They also help with the scoring and ranking of HUD applications in the community. They created quality practices for agencies to engage with people with lived experience. They assist on other projects with youth experiencing homelessness, City of Las Vegas system of care projects, and they also assist us with our grant or contract with Washoe County for the Lived Experience Advisory Board, or LEAB, which started in 2023. Now there is 5 independent contractors, and they all have lived experience of homelessness within 1 year, right up north in Washoe County. They work closely with the Northern Nevada COC, NNCLC, and they work closely with RAW members, so they present at a lot of their meetings. So they assisted with the rating and ranking of HUD applications. We're currently wrapping up our coordinated entry focus groups. They review a lot of policies and procedures that the COC has and make recommendations and submit them directly to Washoe County. We're doing a lot of surveys. They're really doing the work. I only go there once a month. Surveying unsheltered individuals to gauge how they think the community is doing and what could be better in the community. So they've completed the coordinated entry focus groups. This week, they're actually meeting with the agencies one-on-one to share their reviews and recommendations. And then we will be submitting a community document to the COC that indicates recommendations to make their coordinated entry system better for those experiencing homelessness, focusing on person-centered care. And so it's just really exciting to see our individuals with lived experience of homelessness that are working directly with our counties and our COCs and our community providers to make things better, because they can identify things that they experienced when they were homeless, and they have a better understanding often because they've been through that same exact thing that a lot of our clients are going through today. Next slide. And so what's next for NHA? More pop-up events. We're continuing to do training, homeless service provider training. We're planning our 2024 conference that will be in Clark County, and we will be the lead agency to coordinate the 2024 Homeless Candlelight Vigil this year. And we're just excited for all of our partners. We're more excited that we are able to collaborate and partner in the community to be of maximum service to our most vulnerable neighbors in our community. And one last thing I didn't highlight is that as part of our program, our ARPA program, we work closely with the NDOC, where we were given a 6-month no-cost approval to go into NDOC to offer services to individuals who are expiring their sentence and have no financial or social support in the community, because what we're finding is that individuals are discharged to the streets. And if we want to reduce recidivism and kind of stop a little bit of the influence of homelessness, we should be making sure that we're capturing those people coming out of those institutions and looking at the social elements and not just criminogenic elements when we're thinking about recidivism. So we're able to go into 2 of the institutions, as well as do some virtual assessments with individuals in the institution. So we're just really proud to be partners of the NDOC, and we've housed a few individuals who are coming out of prison, meet them where they're being dropped off at, get them to their housing placement. And we've also assisted individuals with returning home to their host family after they're just dropped off at P&P with a bus pass and their belongings, and their housing status would be homeless if not for us stepping in to help. So we're just really proud to be part of the community. And that's all I have for today. Thank you for allowing me to share. Any questions?
No questions at all?
Guess I was really clear. Sorry.
This is Director Devine. Do you have
Hi.
dates for your 2024 conference yet?
So I have a meeting right after this, and then I have another meeting on Monday. So my goal is to have the date in stone by May 6th.
Okay.
And the conference will be in September or October.
Okay,
Yes,
perfect.
ma'am.
And then the same type of question. I'll get with you offline to talk about the veterans issues. Thank you.
Okay. You're welcome. Oh, for veterans, we have the VA at every event, or our core partners, US Vets or Salvation Army, at our events to capture all of our veterans. And in our community, we have a protocol where we encounter a homeless veteran. We call a veteran hotline number where the VA will send a person directly to that individual to engage them, or send for transportation to send them directly to the VA. After they're approved, they meet the definition of veterans.
Thank you.
Yes.
So this is Robert Thompson. I don't have any questions. I just wanted to comment. Thank you for the shout outs to the Welfare Division. Welfare Division is huge. We run multiple programs and have about 2,400 employees. So I don't even know, there's no way I can track everything that Shelley's team is doing all of the time. So it's really nice for me to get on these calls and see how much our agency is embedded out in the community.
Yeah.
So thank you for adding us to your slides.
They're amazing. When they set up, we have to have a whole waiting area. Like they have a tent with a table for the staff and then a full like little waiting area, because there's always like a big line of individuals who need their services. And so it really helps for them to be there. Thank you so much.
Thank you. Thank you for that partnership. Do we have any other questions or discussions for item 5? Okay, we will move on to informational item number 6. Update on the progress of Assembly Bill 310, Stephen Acroft, but I believe, Stephen, that Christine Hess is going to be giving us the update.
Good afternoon, Chair and members of the council. This is Christine Hess. So yes, Administrator Acroft did ask if I could be present to give the update.
Fantastic. We are all yours.
Excellent. Well, thank you so much for your patience. As a reminder for everybody, Assembly Bill 310 from the 23 session appropriated $32.2 million of general funds to the division to essentially support supportive housing in the state by primarily funding the services. There are also that are aligned with housing. There are also components of the bill that include capacity building and also the tracking and monitoring. The reason why I'm here today is because this council, the Interagency Council on Homelessness to Housing, is named in the bill. The division is required to consult with this group before we make our awards. So you'll have to forgive me. I'm also new to government. So I did initially notice a public workshop for our regulations, which we have provided to LCB. I missed one notification. So if anybody was thinking it was going to be May 9th, that is not correct. So for an update, we will be having a public workshop on the regulations that were drafted and sent to LCB on April 11th. The public workshop is currently scheduled for May 16th at 10 a.m. I will send Chair yourself and this group the notice so that everybody can be aware and of course are invited to attend. The regulations per the bill do of course outline eligible entities and the criteria for which the division will evaluate each application and the frequency of the applications. Additionally, on the agenda for the public workshop, we will discuss the program design and implementation for the program. So we are also in the process of hiring a grant program analyst 3 that was included as a fiscal note to Assembly Bill 310. With that, I guess let me also provide the LCB file number. Again, I'll provide all the materials directly to this council, but the LCB file number for those regulations is R078-24I. So with that, Chair, I'm happy to go into more details, discussion, however you prefer the update, but I'll keep it short and sweet and in there for now.
So thank you. Do we have any questions or any requests to go deeper? Thank you, Ms. Hess. It sounds like everybody is happy with the response.
Thank you so much. Thanks everybody for all the work that you do too.
Okay, we will now move on to informational item number 7, update on the Interagency Council on Homelessness Technical Assistance Subcommittee. Michelle Fuller-Howler.
Good afternoon. Thank you, Vice Chair Thompson and council members. I appreciate the opportunity to speak with you this afternoon and to give you an update on the Technical Assistance Committee. As I've told you each time I've been in front of you, we continue to meet monthly, and we are excited that we meet quorum each month so that we can meet monthly, and we get a lot of work done during each of our meetings. I'd like to update you that on April 9th, I was able to present on behalf of you all, the ICHH, to the Nevada Silver-Haired Legislative Forum on the ICHH and the landscape of homelessness on seniors experiencing homelessness across the state. And then switching hats to my COC coordinator hat, I, under the same agenda item, presented with my colleagues Brenda Barnes from Southern Nevada and Dana Searcy from Northern Nevada. And we, all three of us, presented on the status of senior homelessness in each of our geographic regions, so that the senior-haired, silver-haired legislative forum understood what the senior populations are experiencing regarding housing instability and homelessness across the state. And then Donalda Binstock talked about senior services that are being provided with Clark County Social Service. The Technical Assistance Committee held an open call over the last couple of months to fill some vacancies that we had for the Technical Assistance Committee. We had 5 applications. We accepted 3 or voted in 3 new members at our last meeting on April 16th. So we welcomed Kimberly Martin, Adrian Babbitt, and Julie King to our Technical Assistance Committee. So you will now see those names on our documentation. So if you have an opportunity to welcome them to the Technical Assistance Committee, please do so. We're actively working on combining all of the information that has been taking place in the various work groups that we have been conducting over the last year to create the action plan. So that is all being consolidated into a condensed action plan. We are potentially rearranging some of the work that has taken place for better alignment within the strategic plan. And there may even be some changes and realignment within the existing strategic plan that we'll bring back to you. But we still anticipate getting to you the action plan completed in advance of August, so that you and our legislators are able to use it when you're preparing bill drafts for the next legislative session. And then we also received a really exciting presentation from Civic Roundtable. If you haven't heard of the Civic Roundtable, I would really encourage you to look into that. They help practitioners across COCs, service providers, government agencies at all levels work together to prevent and end homelessness. Their secure, purpose-driven collaboration platform really makes sharing resources and ideas easy. They support agencies, interagency councils, COCs with a purpose-driven platform that helps to streamline coordination and reduce burnout. Right? It was built with us in mind, right? And to recognize the challenges that we have communicating across agencies, especially when we are working with governmental agencies and doing the complex work on the ground. So the team was really interested in what they presented and the possibilities of how this platform might be helpful in the work that, not only the work that ICH is doing, but the work that, more importantly, the work that it's going to take in implementing the statewide strategic plan, and what that looks like on the ground in our COCs and in the communities across the state, and how it would be helpful in us in tracking implementation, tracking or allowing communication across the state, and for us to track progress on that strategic plan. So we really would like to recommend to you all that you consider inviting somebody from the Civic Roundtable, maybe for a presentation to this board, and ask that you just maybe listen to them, consider what they have to say for potential adoption or implementation for our state, for us to use as a potential platform. So with that, I'm open for questions, and that ends my presentation. Thank you.
Thank you so much. Do we have any questions for Michelle? Okay.
I have a question. Michelle,
Okay.
can you plug the name of that agency you just mentioned into the chat? Just so I can have it.
If the chat is open, I sure can.
Oh, okay. Or you can just tell me, I can write it down.
Yeah, this is Ryan. I prefer nothing be put in chats.
Okay.
It's Civic Roundtable.
Civic Roundtable. Thank you.
Okay. Any other questions? Anything for Michelle to go deeper? Okay, informational item number 8, discussion for agenda items for the next meeting on May 23rd, 2024. So we have our next meeting set. Is there anybody on the line who has recommendations for us for the next agenda? If not readily available on this call, we can always email them to Shelley Aguilar. Going once, going twice. Okay, we'll now move to item number 9, our second public comment. No action may be taken upon a matter raised until the matter has been specifically added to the agenda. Comments are limited to 3 minutes. If you are making a public comment via phone, please call 1-775-321-6111, ID number 179-655-435. We are now open for public comment. Please unmute yourself and state your name for the record. Do we have anybody on the line for public comment? Anybody on the phone for public comment? Okay, we will adjourn for the next meeting on May 23rd. We are adjourning this meeting at 2:14 p.m. on April 25th, 2024. Thank you so much for your attendance.
Thank you.